May mga usaping pangkalusugan na dapat talakayin ng tama, malinaw at may malasakit. Nandito tayo ngayon para gawin yon. POGScast, Let's Talk Pinay.
Ito ang POGScast, hatid sa inyo ng Philippine Obstetrical and Gynecological Society.
Kapag ang isang babae ay na-diagnose ng cancer o iba pang kondisyon na kinakailangan ng matinding gamutan, ang naiisip agad nila ay, gagaling pa ba ako? Iba ang usapan para sa mga young adults o mga babae na nasa reproductive age. Ang naiisip na nila, pwede pa ba akong magkaanak? Makakabuo pa ba ako ng pamilya? Yan ang tatalakayin natin ngayon sa Fertility Preservation 101. Fertility Preservation 101. Doc, ano po ba ang fertility preservation?
Thank you, Gladys, for your question. Pag sinabi nating fertility preservation, ito isang disiplina na nangangalaga o nagpe-preserba ng reproductive functioning ng babae o lalaki. No? Kasi itong mga pasyenteng to ay maaaring maging baog. They might lose their reproductive potential gawa ng gamot na binibigay natin sa kanila, whether it's chemotherapy or radiotherapy or surgery. So this is a way by which we can preserve their eggs, their sperms, their embryos, and even their ovaries and testicles in order to produce babies in the future.
Sino-sino po ba yung mga kinakailangan mag-consider ng fertility preservation?
So the number one patient would really be the cancer patient, the young cancer patient. Kasi syempre kung medyo matanda na, there's really no point in preserving, di ba? Kasi wala na, dumiliit na rin ang chance nila magbuntis. So it will have to be the young cancer patient na who will undergo chemotherapy or radiotherapy or mga bone marrow transplant or ovarian surgery or testicular surgery. So bago pa sila magbigyan ng kanilang tamang gamot para sa kanilang cancer, binibigyan natin sila opportunity to preserve their eggs or their sperms or their embryos and also their ovarian or testicular tissue. Richie, ano pa yung iba?
Kasi pag may cancer ang babae or lalaki, yung mismo treatment natin for the cancer, kagaya ng chemotherapy,
Correct.
Radiotherapy, and even yung mismo surgery na gagawin can cause a drop yung sa babagsakang follicle number, pati yung production ng similya, pwedeng mawala. So ito yung mga pasyente na pwede nating matulungan kasi hindi nagtatapos sa treatment ng cancer. Ang survival rate ngayon after cancer treatment is improving. Tumataas na siya.
That's so true. Kasi nung araw, di ba, yung mga tao, pag sinabing cancer, ay nako, ibig sabihin mamamatay na ako. Ngayon, marami na nabubuhay galing sa gamot ng cancer nila. So as much as 95% actually survive their cancer. So what are they gonna do? Pag halimbawa, they're in their 20s or early 30s, gusto nila magkaanak. Paano sila magkakaanak kung nabigyan sila ng gamot na nakadamage na sa kanilang ovarian function or testicular function? That's why we need to offer these fertility preservation techniques, no? So bukod sa cancer, would be those with autoimmune diseases, yung mga may lupus, yung may mga rheumatoid arthritis, so yan.
ITP.
So, yan, ITP or mga thalassemias. Itong mga taong to, hindi naman talaga cancer yung condition nila, pero ginagamot sila ng mga gamot na nakaka-damage ng reproductive functioning. So kailangan din mabigyan sila ng chance na ma-preserve yung kanilang ovarian function, no?
And maliban doon, may mga genetic conditions kagaya ng Turner syndrome sa babae, Klinefelter sa lalaki. So bago pa tuluyang mawala yung production ng itlog at similya, kailangan makuha natin to at maitabi, ma-freeze para magamit nila in the future.
Kasi nga, ang normal age of menopause is 51. Pero itong mga taong to, at the age of 20s, 30s, menopause na sila. So, pwede pa rin nating makuha yung chance, yung makakuha tayo ng mga itlog sa kanila, na pwede nating i-freeze, na pwede nilang ma-fertilize in the future and makabuo ng baby in the future. Tapos, meron din tayong mga patients, may mga endometriosis, na may mga bukol sa, yung tinatawag natin chocolate cyst. Ngayon, pwede na nating, bago natin sila operahan, pwede nating mag-freeze tayo ng eggs, no? Kasi nga, pag inoperahan mo ang taong may endometriotic cyst, usually yan, nadidestroy na yung ovarian tissue nila. Minsan nga to the point na nagbe-menopause na sila ng maaga. So, ayaw nating mangyari dun sa kanila. So, ang gagawin natin, pwede nating i-offer mag-egg freezing, tapos, then they can go through the surgery, and those eggs can be fertilized in the future pag meron na silang partners.
Okay, so mga ka-POGScaster, no, yung mga babae man o lalaki na mayroong cancer, autoimmune diseases or genetic conditions na nangangailangan ng chemotherapy or mahabang gamutan, kailangan i-consider, no, pag-isipan ang pagpapa-fertility preservation.
Yes.
Po, dahil ang mga ito, no, yung mga gamutan nyo, maaring maapektuhan ang mga reproductive organs.
Hindi lang chemotherapy, radiotherapy.
Yes.
So especially kung
And-
meron kang radiotherapy that will focus on the pelvis, so that can destroy yung ovarian tissue. So gusto nating ma-save yung mga yung ovarian tissue na yun.
And the very common, endometriosis, Dok, parang left and right yan.
Correct,
Nakikita na
correct.
natin sa clinics po natin.
Lalo na ngayon, kasi dati ang treatment talaga dyan, opera ng opera ng opera. Minsan, nakakadalawa, tatlong opera sa isang pasyente. So, yung mismong procedure na yun, ang nakakatanggal ng mga itlog. Bawat pagtanggal mo ng cyst, marami or millions of eggs ang pwedeng mawala.
Correct. Yung iba nga may menopause na. Kaya nga, as much as possible, pag may endometriosis, hindi nga tayo nag-opera ngayon eh. Hindi katulad dati. The moment na mag-diagnose ka ng endometriosis, operahan mo agad. Ngayon, pwede natin i-conserve muna yung eggs. Or kung halimbawa may partners sila, they want to have babies, ngayon meron na tayong ino-offer na in vitro fertilization bago tayo mag-consider ng surgery for patients with endometriosis. And also the patients with early cancers, no? Diba? Yung mga early ovarian cancer, early uterine cancer, mga very early stages of cervical cancer, we don't have to remove the whole uterus. We don't have to remove all the ovaries kasi that will make them sterile. So, pwede nating like yung for early cervical cancer, pwede kang conization lang sa cervix o kaya tanggalin mo lang yung cervix and pwede pa rin magbuntis to in the future, no? So yung uterine cancer, tatanggalin mo yung isi-scrape off mo yung cancer and then magbibigay tayo ng anti-estrogen treatment that will reverse the cancerous process and then pwede pa rin magbuntis yung mga taong to. Yung may mga ovarian cancer naman, early ovarian cancer, pwedeng tanggalin mo lang yung basta early stage so confined to one ovary, pwede mong tanggalin yung ovary na yun. Pwede pa rin siya magbuntis sa kabila. And of course, we can do ovarian tissue cryopreservation naman of the other ovary.
So, ang tawag natin doon, fertility sparing surgeries.
Naman, oo.
Okay, so mas conservative. Hindi natin tinatanggal.
Hindi tinatanggal na. Tsaka ngayon kasi, hindi na tayo masyadong nagtatanggal ng lahat. Nung araw kasi, wala pang masyadong mga gamot, no? So, lagi ang cure tanggalin ang matres, tanggalin ang ovaryo. In fact, miski benign, miski myoma lang, pati ovaries tinatanggal. Ngayon, hindi na. We try to be as conservative as possible. Kasi marami tayo sa mga pasyente natin gusto pa rin magka-babies in the future. Especially these young cancer patients, no?
Napakagandang punto po yan, no? Hindi lahat ng endometriosis, hindi lahat ng cancer kailangan opera agad. So, kailangan magtanong po, no? Or magbasa na rin. Yan na yung usual na ginagawa ng ating mga audience at mga pasyente. Hindi po lahat kailangan operahan. There are options. Speaking of options, ano po ba yung mga options natin for fertility preservation?
Okay, so three main actually. Well, for the male, isa lang sperm freezing. Pinakamadali nga yun Ang problema lang kung pre-pubertal yung bata. So kung pagkaganon, meron pa rin tayong techniques in order to produce the sperm, no? Meron silang mga vibratory methods para mag-produce ng sperm yung pre-pubertal. Pero generally, pag post-pubertal na, okay na. So, they just have to produce the sperm. Now, yung testicular tissue cryopreservation, actually experimental pa yon. Pwede pa rin tayo mag-extract ng sperm for some na hindi talaga makaproduce through ejaculation. So, that's for the male. For the female,
So, sa female naman, nabanggit kanina ni Dr. Manalo, may egg banking tayo. Okay, so hukunin natin yung mga itlog after ma-stimulate. Kung may partner, pwedeng embryo banking. So, yung asawa niya magbibigay ng sperm, bubuo tayo ng embryo. And then, kung depende sa panahon na maibibigay ng mga oncologist, kung may panahon pa at hindi pa kailangan mag-chemotherapy, then pwede tayong mag-oocyte banking or embryo banking. Pero pag kulang ang panahon at kailangan na talaga, then meron tayong ovarian tissue cryopreservation.
That's a good point, Richie, no? Kasi kailangan we work hand in hand with the oncologist. Hindi naman pwedeng pupunta yung pasyente tapos talagang mag-fertility preservation na tayo. So we have to work hand in hand with the oncologist. If the oncologist, the cancer doctor says, oh, we have about 2 weeks, 3 weeks time, o sige, pwede pa rin tayong mag-fertility preservation with the egg and the sperm and the embryo, no? no? Pag hindi talaga, halimbawa talaga yung prepubertal na babae, tapos, yun nga, yung very aggressive yung cancer, ito nagmamadali na talagang bigyan ng chemotherapy or radiotherapy itong pasyenteng to. That's the time that we do ovarian tissue cryopreservation.
So you mentioned 3 po, no?
Yeah.
Egg preservation, and this is for females.
Yes.
Then embryo preservation, if meron na pong partner, no? So it's the egg and the sperm, no? Equals the embryo. And then another one, usually for cancer patients po, is the ovarian cryopreservation.
Pero pwede pa rin for endometriosis.
Yun.
Yung patients undergoing surgery, aside from doing egg freezing or embryo freezing, kung may partner, we can also do ovarian tissue cryopreservation in those patients na may ovarian cysts, na pwede mong kunin talaga yung small tissues and then preserve them and then use them for later.
Actually, sa isang procedure, kunyari na tanggal mo yung cyst, meron kang normal ovarian tissue at sa microscope may nakita kang follicles, pwede mong i-freeze din yung mga itlog maliban sa tissue.
Yun yung in vitro maturation na yun.
Yes.
So, miski immature eggs, hindi mo na kailangang stimulate. Pwede mo nang kunin yung immature eggs na yun, which can be cultured in the laboratory to produce mature eggs.
Yeah.
So, maraming magagawa with that procedure alone.
Ang daming preservation, ang daming terms. Doc, lahat ba, or saan ba sila pwedeng pumunta if they're interested for fertility preservation? Pwede bang...
Now, I think there are about, 17 IVF centers in the country?
Going 17.
Yes, we have about 17 all over the country. And so they can go to any of those, no? Like say, you're about to do surgery for, say, endometriosis. So you're a general OBGYN. Pwede mong kontakin yung mga laboratory yun, and the laboratory can actually provide yung embryologist na pwedeng kukunin mo yung ovarian tissue, tapos sila na yung magpe-prepare ng ovarian tissue, tapos sila na yung mag-freeze. So kaya wag natin kakalimutan yun, no? So miski hindi specialista sa infertility, miski hindi ka involved in an IVF center, pwede mong kontakin yung mga IVF centers, they can do that for you. And also, basta meron kayong patients na cancer, cancer patients, don't think na, ay nako, cancer na to, mamamatay na to. Talagang, tapos oncologist lang gagamot sa pasyente. Think of fertility preservation. So contact us. Of course, you have to get in touch with the oncologist also. Contact us so that we can already counsel the patient. It's really part and parcel of fertility management in these cancer patients.
So, reproductive endocrinology, infertility specialist, and oncologist po, no? Ideally, ang makapag-manage po sa inyo para mag-guide po kayo kung ano po yung mga best na options for you. Kanina po, Doc Richie, na-mention niyo po about kung nagmamadali ovarian preservation na. Gaano po ba katagal, ideally, yung parang pinaka-best chance natin na antayin before makapag-preserve?
So, ang pinaka-accepted talaga and highest, kumbaga, yield ay yung oocyte cryopreservation. Kung may panahon, kailangan lang namin ng mga 2 linggo, okay, para enough na mabigyan ng injections, mga gamot, para mapalaki yung follicles at makuha yung mga itlog, ma-harvest natin yan. So, at least 2 weeks. Pero kung hindi nyo kami kayang bigyan ng 2 weeks, yun, ovarian tissue cryopreservation tayo.
Yun po, immediate, pwede.
Immediate
Yes,
na.
immediate.
Oo.
Doc, may isa pa ako narinig kanina eh. Banking. Alam mo naman ang mga natin, pasyente. Pag narinig na ang banking at mga terms na parang kakaiba, nagnenervyos na po sila sa gastos.
Okay.
Ano po ba ang pinagkaiba ng mga methods na na-mention nyo kanina in terms of gastos? Tapos, syempre, in terms of success na rin po.
Okay, in terms of success, yung egg freezing kasi, as much as mga 80% yan eh. Pati yung actually yung pinaka-successful sa embryo freezing kasi nabuo na yung embryo eh. Remember, the egg has to be fertilized. Pwede pa rin siyang hindi ma-fertilize. Di ba, fini-freeze mo siya, tapos pag tinaw mo na siya, pwede pa rin hindi lahat yan mabuo. So, hindi ganun it's successful enough, but pinakamagaling pa rin yung embryo. Kasi nabuo mo na yung embryo, pinaabot mo na nga siya sa blastocyst stage, so mas maganda na yung chance niya mag-survive. So, 80% ang chance niya, 60 to 80% kung less than 35 years old. So, syempre, the older the patient is, the lower the chance, no? Tapos, tawag dito, yung costing.
Yeah, so tinanong mo kanina yung cost. So depende kung anong procedure. Kung oocyte banking, kailangan ng pera syempre para sa gamot. para ma-stimulate. So, sa ngayon, yun yung medyo magastos, yung stimulation.
Siguro mga 250,000.
Mga ganyan.
ganun, oo.
Buo na yun, buong proseso na yun. Okay?
So yun, tapos yun lang nga, kasi binabank yan, meron kang binabayad sa laboratory on a yearly basis. So yun, kaya nga, huwag mo namang hintayin na 50 ka na para magamit yung eggs na yun. No? Remember na, okay, mas bata ka nung kinuha yung itlog mo, mas maganda yung chance mong mabuo yun, pero tumatanda ka pa rin eh. Kasi ginawa mo yan ng 45 years old ka, mas matanda ng matres mo. Baka meron ka ng myoma, meron ka ng adenomyosis. Tsaka baka matanda na rin yung katawan mo to the point na meron ka ng mga sakit, diabetes, alta presyon, na hindi mo na kayang magbuntis. Kaya dapat sana, when you talk about these things, you have to do it as soon as possible time, no? So that, strictly speaking, these eggs, these embryos can last a long time. Yung testicular is actually, the sperm freezing has lasted generations yan, no? So talagang literally kasi nga with improvements in vitrification, yung egg freezing technique or sperm freezing technique, talagang they can last a very long time. The longest was a 29-year-old who froze her embryos, 51 years old siya, nagpalagay, tapos nagbuntis siya, nanganak na siya. It's a Japanese woman. Pero yun nga, tandaan nyo na tumatanda rin ang matres nyo, tumatanda rin kayo. Kaya gusto natin magamit ito as soon as possible time. Kaya most cost-effective siya. Kung halimbawa nag-freeze ka nga at age 40 or 38 to 40, kasi most likely gagamitin mo na agad yun eh. Whereas if you froze at the age of 30, that's a good 10 years pa bago mo magamit. Pero kung ginamit mo na 32, 33, mas maganda syempre yung matres mo.
Actually, kung titignan natin yung data, yung tinatawag na utilization rate, hindi rin ganun kataas.
Correct.
Maraming nag-freeze ng eggs, pero kung titignan mo worldwide, siguro mga 12 to 15% lang yung bumalik.
Correct.
Para gamitin to.
Kasi bakit ka mo?
Bakit po?
Nag-asawa sila eh.
Yeah.
Tapos they found their partner.
Hindi pala nagamit.
Hindi na nagamit.
Late bloomer
Yung iba
lang
na,
pala.
yung iba naman kasi talagang they're so busy. They got so involved in their work na hindi na talaga sila nag-isip na magka-baby, no? So talagang only about 12 to 15, 16% will come back for their eggs.
Doc Eileen, emphasize lang po natin, the best age for women to preserve their eggs
Is 30 to 35. So, ito na yung social egg freezing naman. So, pag sinabi nating social egg freezing, wala naman silang sakit, no? Gusto lang talaga nila na, kumbaga, i-pursue muna yung other parts of their life, their career, their education. So, gusto na magka-baby in the future, yes, but they're not ready for that yet. So, yun, pwede tayong mag-social egg freezing. And they have to go through the process pa rin of stimulation. Yung sinabi nga ni Richie, na 10 to 12 days of stimulation to produce the most number of eggs para naman, you know, you have a chance of pregnancy. It's not a guarantee. Hindi porke nag-freeze ka ng eggs mo, for sure magkaka-baby ka in the future. You hear stories na 3 eggs lang yung na-freeze. Chances are wala kang mabubuo nun kasi kakaunti lang. No? Pwede pa rin, of course. Kaya lang, the more you have, mga 16 to 20 for younger patient, would give you a better chance of success.
So sa babae, 30 to 35, pero beyond that po, Doc, pwede pa rin.
Pwede pa din.
Pwede pa din.
Pwede pa rin.
Actually, pag tinatanong ako ng pasyente, Doc, when is the best time? Sabihin ko sa kanya, now.
Yes.
Diba? Kung ano mang edad mo.
Correct.
Maliban na lang kung sobrang tanda na. Meron pa rin ganun,
Meron pa rin,
pupunta.
meron pa rin.
44, 45, parang...
Pero alam mo, sinasabihan mo na talaga, alam mo, ang chance natin is very low. Baka we have to do it several times for us to produce those eggs that you want. But they will still try. So we don't really tell them off unless menopause na. Siyempre, pag menopause, wala na makukuha.
May age ba kayo, Doc, na parang pagdating sa clinic, Doc, gusto ko ng preserve ako ng eggs. Tapos parang kayo, no.
Hindi naman no outright. So, i-check mo pa rin. Sasabihin mo, 42, 43, mababa na yan, makuha natin. Pero sige, subukan natin. I-check natin yung ovarian reserve mo. So, we still test din yung anti-Mullerian hormone level, tapos yung day 2 FSH, LH, and estradiol. Kung pwede pa, we try. We actually advise them. Your chances are low. Baka there will be times wala tayong makuhang eggs at this time, but we can give it a try. And if they're willing to try, yes, we do allow them. So
And
we don't say outright na no.
Yung kabilang side naman ng spectrum, pag sobrang bata, okay, lalo na kung social egg freezing, hindi kailangan na mag-bank agad. Kasi minsan may pupunta 26, 27. So, ang pwedeng gawin is, yun nga, i-check natin yung ovarian reserve. So, we can do anti-Mullerian hormones. So, kung makita natin na normal, pwede natin sabihin, wag muna. Balik ka na lang pag nasa 30 to 35 ka na. Pero pag mababa na to, then we can do oocyte banking.
Oo, kasi minsan, bata nga, pero talaga naghihingalo na pala
Yeah.
yung ovaries. So we don't outright say, wag muna, you're too young. We check them first, no? Kasi meron talaga tayong mga pasyente who are predisposed to early menopause.
Yeah.
And we're seeing more of those patients now.
Okay. So if you're not in the ideal age of 30 to 35, you can have a test done, no, the anti-Mullerian hormone or AMH, to guide you. Kailangan mo bang magmadali or wait, okay ka pang mag-chill, ipon ka muna or prioritize other things.
Yes.
May concern naman po, Doc, about safety. Yung bang mga babies po na product of the fertility preservation when they eventually, meron po bang mga congenital anomalies or may mga nagiging problems po ba sila?
This is a good question. Let's put it this way. It makes use of IVF, diba? All this fertility preservation technique. And there are now 17 million babies born of IVF. And these are good babies, very intelligent babies, doing very well. The oldest now is Louise Brown, who was born in 1978. Okay, so she's 48 years old. And she's a pretty intelligent lady and very productive.
And trivia, ma'am, yung anak niya nag-IVF din.
Ayun, hindi ko alam yun.
Yung anak niya nag-IVF din at may pinanganak na normal din na baby.
Ayun. So talagang, kumbaga, safety-wise, yes. Of course, there will be patients who will be hyperstimulating. So kailangan, tayo. We're also on guard there. So if they are at risk of hyperstimulation, we take steps to prevent those. And they should be closely monitored.
So, baby, no, regardless if you're from IVF or a product of the preservations po, no, and the normal way, walang difference po na nakita. No, so, mommies, safe na safe po yan. What about po yung mga mommy, yung sa mommy naman itself, you mentioned about hyperstimulation po, Doktora. Pag naman po nagbubuntis, kasi po merong mga, minsan, di ba, nababalitaan nila na, baka maselan ang pagbubuntis dahil IVF siya.
Actually, totoo yan, ha? Mas pasyalan talaga ang pagbubuntis pag na-IVF. First of all, it's the condition. So usually these patients, well, in general, we're not talking about fertility preservation. Usually they're much older. They usually have diabetes, polycystic ovary syndrome. Some already are hypertensive, no, by the time they conceive. So yung inherent problem nila na ando na eh. Tapos, so that makes them at higher risk of complications during pregnancy. Likewise, higher risk of miscarriage, lalo kung may endometriosis, adenomyosis. So it's really the diagnosis which prompted the IVF process. But in general, of course, they're healthy. I mean, they're well taken care of. Yun nga, higher risk of miscarriage, higher risk of preterm delivery, higher risk of diabetes, growth restriction. But these are risks. In fact, meron namang other extent, mas malaki namang babies, no? IVF babies. But again, generally, they are healthy people, and for so long as they have good prenatal care, they do very, very well.
And kagaya ng any pregnancy, whether it be through IVF or natural, kung medyo may edad ka na, bumalik para ilagay, syempre may mga comorbidities na lumalabas because of age. At lalong nagiging malala kung nagbuntis ka pa. Although may mga procedure tayo sa IVF, gaya ng preparation ng endometrium, di ba? So some studies show na mas maganda pa rin yung natural way of preparing compared sa hormone replacement. So yun, medyo may mga perinatal problems na medyo mas mataas doon sa artificial way of preparing.
So, mommies, it's not really, hindi po siya dahil doon sa IVF itself or dahil produkto siya ng fertility preservation. Sabi nga po nila, Doc, it's because of the inherent risk factor na nung pasyente, yung edad o kaya yung mga sakit na meron po sila. Maliban po ba doon, meron pang ibang mga factors na nakakaapekto doon sa outcome ng fertility preservation na
Ako, I can't really think much of anything. But the thing to do is really just to go for it at a younger age. No, I mean, if you preserve now your eggs, your embryos, don't take too long. No, don't use them at a much later date. If you can use them the soonest possible time. Lalo na, cancer patient. Magaling ka na pala eh. O kaya mo na palang you're cancer-free, you're in remission, then use your eggs, use your embryos. Work on a pregnancy the soonest possible time.
Napaka-interesting nung topic natin, Doc. Parang hindi enough yung 30 minutes, no, para talakayin ito. Kung nakakatulong sa inyo ang episode na to, huwag kalimutang mag-like, share, at subscribe sa POGScast. Baka ito na ang impormasyong kinakailangan mo or ng mga taong mahal mo. Ang dami na po nating mga katanungan from our audience. One is, napag-usapan niyo po yung tungkol sa pagpapa-freeze ng itlog. Paano naman po yung sa lalaki? Yung similya or sperm?
Actually, yan ang pinaka-accepted ngayon para sa lalaki, ang sperm freezing. So, wala namang edad. Okay? Hindi kagaya sa babae, mas importante between 30 to 35. Sa lalaki, kung kinakailangan, okay, bago mag-chemotherapy, dun sa mga gender reassignment surgery na iinom muna ng hormones, importante makapag-freeze sila bago mag-umpisa ng hormones. Okay? So, yung nabanggit ko kanina, yung may mga Klinefelters. Okay? Habang bata pa at meron pang production ng similya, kailangan ma-freeze yan. And
Richie, let's not forget yung mga soldiers natin. Di ba?
Yun na, ma'am.
So, kung meron silang pamilya, o kaya meron silang asawa, at gusto lang balikan yung asawa nila, at gusto nila magka-baby in the future, they might want to freeze
Yeah.
their sperms. And as mentioned, these sperms can be frozen indefinitely.
ang legal aspect lang doon na hindi pa natin sigurado sa ngayon is
Paano kung namatay?
kung namatay, yung posthumous na
Yun.
tinatawag.
So, kung hindi pumayag yung lalaking gamitin yung sperms niya, hindi pwede natin gamitin. So, kailangan meron tayong directive from the husband na,
Yeah.
okay, kung may mangyari sa akin, kung, kung kamatay ko pala yung sa battlefield, then you cannot use my sperms, hindi mo pwedeng gamitin.
Sasabihin ko pa man din po sana, parang insurance or souvenir nung sundalo.
Parang
Pero
ganon.
only if he really directed na pwede niyang gamitin. Oo.
Opo, so yung mga may partners na soldiers or yung aalis ng matagal, no? Siguraduhin,
Babalik na buhay.
hindi lang sperm freezing.
Oo.
Papirmahin mo
May
na
go
po.
signal na
Opo.
pwedeng gamitin yung itlog niya, ay yung simbilya niya. Oo.
Actually, may case kami niya na naka-admit siya sa ospital. Hindi naman siya sundalo. Pero talagang medyo malubha na yung sakit. Naghihingalo na.
Opo.
So tumawag yung asawa, pwede bang kumuha ng sperm bago siya mamatay? Okay, so kailangan natin maintindihan na hindi lang yung buhay na magagawa after noon. Pero kaakibat dyan yung legalities, yung mana, okay, papayag ba yung in-laws, di ba? So, yun yung mga bagay na wala pa tayong laws supporting. So, hindi natin alam pa kung paano natin
Pero kung may go
gagawin.
signal yung naghihingalong mama, pwede pa rin.
Kasi siguro kailangan rin natin i-take into account po, di ba? Yung bata, lalaki siya na,
Yes.
walang ama. So,
Yeah, that's very
opo,
important talaga.
Isa po
Oo.
siguro yan sa mga factors kung bakit hanggang ngayon, no, sa kultura natin, hindi pa po fully
Hindi pa black and white yung laws
po,
natin. Oo.
kung ba wala pang go signal. Isa pa pong question, no, I think from a cancer patient po to, posible bang bumalik ang ng natural ang fertility pagkatapos ng chemotherapy?
Pwede pa rin. Depende syempre sa chemotherapeutic agent. Ang notorious naman yung mga cyclophosphamide, yung alkylating agents. Pero there are milder agents kasi na hindi masyadong nakakos ng problems. But even those, given those notorious na chemotherapeutic drugs, meron pa rin. So, pag meron ka ng one episode of chemotherapy, pwede ka pa rin gumamit ng fertility preservation. Pero of course, we have to check the ovarian or testicular function.
And maliban doon, hindi lang yung bibigay na chemotherapy, pati yung edad ng babae nung na-chemotherapy
Correct.
siya.
Oo.
So habang bata, may panahon pa para makarecover. Pero hindi lahat. Okay, so may high risk, may intermediate, tsaka low risk.
Correct.
Okay, wala tayong no risk. There's always a risk. And yung sa lalaki, actually, medyo mas resilient yung similya. Okay, so maliban sa chemotherapy, ang masama is yung radiotherapy.
Radiotherapy naman.
Depende sa strength and kung ilang sessions yan.
Correct.
Pero mas nagre-recover ang similya kumpara sa itlog na babae.
Pag po nasa tiyan, mas malakas ang babae. Di ba parang napapanood namin sa Facebook
Yeah.
Mas matibay daw ang mga babae.
Stronger sex
Opo.
daw.
Pero pag
Talaga naman.
Dok, dalawa kami, pumayag ka na. Opo. Yun po, no? So, not all chemotherapy are the same. Tapos, not all radiation therapy is also the same, no? Iba-iba po ang types na ginagamit.
Saka yung dosaging,
Yeah.
frequency.
Yes, and dosing.
Oo.
So, I think you need to discuss that po, no? Tanungin, no? Pag-usapan with your oncologist po. Ito naman po, no? Mukhang tanong siya from a very concerned mother. Pwede po ba ang fertility preservation para sa mga bata?
Okay, ito yung ito na dumadating yung issue ng consent at saka yung assent. Pag medyo matanda na, madali yun eh. So, sila mismo pwedeng mag-consent sa procedure. Pero yung bata, depende yan kung nakakaintindi siya o hindi. So, dapat talaga, yung bata, explain mo kung anong gagawin sa kanya. Tapos, miski pa paano, dapat maintindihan niya kung ano yung pagdadaanan niya. Ito yung assent. Kasi, wala pa silang age of, ano ba tawag doon? Yung age of consent, yung di ba dapat yung 18 to 21 o yung mga ganyan.
Parang hindi pa po ganun ka-mature kung bibigay ng decision.
So kung mga pre-pubertal, kailangan at least naintindihan nila yung process na pagdadaanan nila.
Maliban doon, kailangan din natin mabanggit na syempre depende kung gaano kalubha yung kondisyon nila. Okay? Kasi baka yung mismong procedure na gagawin natin bago siya matuluyang matulungan, makadagdag sa problema
Lalo
niya.
makasama pa. Oo.
Yes.
So kung talagang very serious yung condition nila, yung cancer stage nila is very advanced, hindi na natin siya i-offer.
Yeah.
So talagang kailangan healthy pa rin. So dapat yan, so we offer to young individuals, tapos they should have a good chance of survival from their cancer. So at least 50% survival. Also, they should be alive within 5 years of their cancer. Kasi kung hindi rin naman, what's the point of
Sayang
doing
din ang
this?
gastos.
Tapos yun nga, they should be strong enough to be able to go through any procedure, anesthesia, yung mga ganyan. So if none of that is going to be ang tawag dito, kung wala siya sa criterion yun, hindi natin siya isasama doon sa fertility preservation.
So, dapat may purpose.
Yes.
Alam natin kung para saan po natin ito ginagawa. So, yun lang po yung mga questions na namin. Para po sa mga ibang katanungan, sasagutin po namin yan as soon as makita namin ang inyong mga questions. Ano po ang inyong mensahe para sa ating mga audience?
Okay. Siguro, thank you for that question, Gladys, ha? So, fertility preservation has been in the country actually since 2019 when we formulated the Philippine Society for Fertility Preservation. Actually, disciplinary. So, meron kaming reproductive endocrinologist, meron kaming gynecologic oncologist, meron din tayong mga medical, surgical, and radiologic oncologists. But we also need the help of the lay. We also need the help of all the doctors na dapat tandaan natin kung ang tao ay may chance siyang maging baog as a result of her cancer therapy or even therapy for benign conditions, dapat i-refer talaga sa reproductive endocrinologist and offer that idea of fertility preservation. Kasi sayang marami tayong nakikita, meron akong 39-year-old na hindi na-save kasi yung chance niya magbuntis kasi it was never offered to her. She underwent removal of one ovary because of an ovarian cyst, which is endometriotic cyst. Then she underwent another surgery, cystectomy lang, tinanggal lang yung cyst. Tapos, that was at age 29. Tapos, since then, menopause na siya. So, sayang yung chance. Pwede sana nating na-harvest yung eggs niya before she underwent that surgery kasi isa na lang yung natitira. So, yun. I want fertility preservation to be second skin to us kasi we need to help our patients try to have that chance to have children in the future.
Sa akin naman, ang importante, kailangan mo pag-usapan. Pag nalaman na may kondisyon na nangangailangan ng fertility preservation, kailangan ma-refer. So, hindi naman namin inaasahan na after nitong episode na to, ang dami nang magpapa-fertility preservation. Ang pinaka-importante is the conversation has to be started.
Correct.
Kasi kung hindi napapag-usapan to, nabanggit ni Dr. Manalo, pag hindi mo nabanggit sa pasyente yan at nag-survive siya at balikan ka, ba't di natin napag-usapan man lang?
Alam mo ba, ang doktor nga can be held medically liable kung hindi niya sinabihan yung pasyente about the chance for fertility preservation.
Parang lost opportunity.
Yes, oo.
Diba?
Dapat ng pag-usapan.
Yes.
Sa mga OBGYNs, don't forget to discuss about fertility preservation.
Yes.
Yes.
So maraming salamat po at mas naunawaan namin ang tungkol sa fertility preservation. Mga ka-POGScasters, laging tatandaan, ang fertility preservation ay hindi lamang tungkol sa pag-ingat ng kakayahang magkaanak. Pero ito ay isang pagpapanatili ng mga posibilidad, ng mga pangarap at yung mga pagkakataon na ikaw ay magkaanak at makabuo ng pamilya. Again, maraming salamat po at magandang araw.
Thank you.
Thank you.
Sa bawat yugto ng buhay ng isang babae, may kwento at may kaalaman na dapat pag-usapan at pakinggan. POGScast, Let's Talk Pinay.